Time Management and Professional Nursing, created by Rachel Hayworth. The purpose of this PowerPoint is to demonstrate how important time management is to the professional nurse. There are 4 nurses to include me, the charge, 3 nurses' aides, and 8 critically ill patients on this unit. The following is how the patients have been split up between the nurses' aides and why. Jethro. This patient is appropriate for the charge because he is on a ventilator with rapid, uneven, and labored breathing, experiencing withdrawal symptoms, and will require frequent suctioning. This is a sterile procedure with a potential for desaturation. The increased risk of oxygen desaturation, infection, and withdrawal of this patient needs an experienced nurse who is able to effectively and safely perform these interventions. As charged, it is also important to be able to supervise and assist or intervene as needed for coworkers on the unit. Additional information that may change this assignment is the patient's last known drug use. To determine where in the detoxification the patient is at to better determine increased risk for side effects of detoxification, such as seizures. Gertrude. This patient is appropriate for the charge nurse because she is demonstrating stable vital signs at this time, but has an extensive cardiac medical history. Stable vital signs allow for the charge to continue to supervise, assist, or intervene as needed for coworkers, but the extensive cardiac medical history could result in rapid decline of the patient's current status, where the charge nurse's extensive experience will come into play. Additional information that may change this assignment is if there's any family at the bedside to assist with reorientation or ambulation to the commode as the patient is confused and requires safety precautions against falls. Jason, this patient is appropriate for the new grad RN on her first shift alone because his vital signs are stable and is only awaiting psychiatric evaluation. Due to the new graduate's lack of experience, a patient like this one requiring very few nursing interventions would be ideal. The patient is medically stable, cooperative, and totally alert and oriented. Once this patient receives a psych eval, he may be transferred off the unit, allowing the new grad to take over one of the charge nurse's patients. This would free the charge to provide supervision, advice, or interventions as needed to meet the needs of the unit. Additional information that may affect the assignment would be to know what the discharge plan was. For example, is this patient to return to the same home environment they previously attempted suicide in, or will they be transferred to a behavioral health center? Cheryl. This patient is appropriate for the new grad RN because the patient requires frequent neurochecks and has an elevated blood pressure. Frequent neurochecks will take assessment and reassessment, and due to the patient's current altered mental status, will take much of the nurse's time. The elevated blood pressure is the only vital sign currently out of accepted parameters and should be easily managed with IV antihypertensive medication, but will need close monitoring. Additional info that would be helpful in determining an appropriate assignment: if there are any deficits to ambulation, unilateral weakness, slurred speech at baseline compared to current presentation of the patient. New onset of these symptoms are indicative of a stroke, and rapid management will require to correct versus baseline deficits that need to be monitored but will only require safety interventions. Jamie. This patient is appropriate for the experienced nurse because she is experiencing unstable vital signs and has a chest tube. The oxygen saturation at 85% on a non-rebreather is in need of immediate intervention. The oxygen mask is only at 4 liters per minute. For a non-rebreather, this number can go much higher. Desaturation could indicate that the chest tube has become dislodged and will need surgical management to improve. In addition to improving the patient's oxygenation, the patient is experiencing SVT, which can turn into a life-threatening rhythm if not corrected immediately. The rapid actions required to stabilize this patient need an experienced nurse to manage effectively. Additional information that may have changed this assignment is the patient demonstrating symmetrical chest rise. Has the chest tube become dislodged? These are questions that the scenario alludes to, but is never safe to assume. If there's not symmetrical chest rise, the patient will definitely need surgical interventions, but it could just be that the water seals become unconnected somewhere along the tubing, and that is what is causing the issue with the patient's vital signs, which is a quick fix. Cara. This patient is appropriate for the experienced LPN because the patient is on an insulin drip and the patient's attitude. Critical drips require close monitoring and prevent the need for rapid interventions. This patient is clearly non-compliant with the restrictions placed on her as demonstrated by inappropriate cowbell usage and wandering the halls naked if not given the attention desired. This will need to be rectified by strict setting of rules by the nurse. The experienced nurse will be able to set these limitations and adhere to them. Additional information is the patient's discharge plan of care, drug cessation counseling, and psychiatric consult. The patient's blood sugar is on the way to being controlled. Due to the patient's frequent admissions for the same problem, determining the patient's plan upon discharge could help prevent further readmissions related to this diagnosis. Drug cessation should be performed as frequent polysubstance abuse will have a negative impact on the patient's pre-existing comorbidities. Due to the patient's behavior, a psychiatric consult should be performed to not only assist with drug cessation, but also to help with the patient's apparent need for attention. Amelia. This patient is appropriate for a very skilled and experienced nurse, based on the poor vital signs, need for blood transfusion, frequent wound care, with a current altered mental status. This is a severely ill patient requiring an experienced nurse. With 15 years of experience, this nurse will be well equipped to handle the aggressive interventions needed to stabilize the patient. The patient's vital signs indicate infection advancing to sepsis and possible septic shock. The patient's oxygen saturation indicates the body is already compensating and rapid interventions will need to occur. The experienced nurse will handle the increased stress of attempting to stabilize the vital signs while also providing safe and efficient patient care. Add to the poor vital signs the need for aggressive wound care to further gangrenous tissue to the left foot wound. This is a very time-intense patient that the nurse with experience will know how to manage best. Additional information required about this patient would be the baseline mental status and history of previous blood infusion. Based on the order to pre-medicate the patient, it can be inferred that the patient has had a previous blood transfusion reaction, but the degree to which the reaction occurred is not stated. This knowledge is important for the nurse to be aware of. Additionally, the patient's baseline mental status is imperative, as one of the signs of advancing septic shock is an altered level of consciousness. Knowing the patient's baseline allows the nurse to assess if interventions are being effective. Jenny. This patient is appropriate for the experienced nurse due to the severity of the patient's presentation and unstable fracture of the leg. The patient is diaphoretic, has blue and cold extremities, requires traction, and has unrelieved pain. A fracture of the long bones of the leg are at increased risk for developing a fat embolism. Based on the patient's diaphoresis and the blue and cold extremity of the affected leg, indicate this patient is not getting current blood flow to the left lower extremity and will need immediate intervention. The duty of the nurse in regards to the patient's traction is to ensure the weight is off the floor, alignment of the affected extremity is maintained, infection prevention, and to notify the provider if a problem with traction is in place. An experienced nurse with 10 years on the floor with patients like this previously will be more comfortable working with the traction. This patient has pain medication ordered every 2 hours as needed, yet it has been 5 hours since last administration. Uncontrolled pain could be reflected in the increased vital signs and should be fixed to determine how the increased vital signs are related to the left femur fracture. The provider will need to be notified and immediate interventions will need to take place. The experienced nurse will feel more comfortable and better able to reassure the patient with their calm demeanor and prompt reassured actions. Additional information that may change the assignment would be if traction orders are in place. If not, these need to be in place and the provider will need to be called to put in place if not currently in place. When was the last dose of IV PRN antihypertensive? If it was given recently and the patient is still demonstrating no improvement in systolic blood pressure, further interventions will be needed and the provider will need to be notified. This concludes nursing assignments for this unit. The nursing assistant assignment is 4-to-1 ratio with one nursing assistant assigned to be a safety sitter for the 1-to-1 suicide risk. Shelby. I assigned Shelby Jethro because he is on a ventilator and anxious. The ventilated patient requires careful nursing care to prevent infection or displacement of the ventilator. Gertrude is appropriate for this nurse aide because she is confused with extensive cardiac history, requiring frequent communication with the nurse as to the patient's vital signs and current demeanor. Cara, due to the patient's attitude. This patient is a frequent patient and, like the experienced nurse assigned, will need strict rules and limitations set to ensure safety and appropriate behavior. Jamie is appropriate because of the chest tube and unstable vital signs. These will need frequent rechecking and updates to the nurse to ensure the interventions taken demonstrate the patient improvement. The experienced nursing assistant will be able to handle this extensive workload and maintain communication with the nurse to ensure safe patient outcomes. To Frances, I assigned Amelia due to her unstable vital signs and the need for frequent checks. Jason has a 1-to-1 sitter for suicide precautions. However, when the sitter needs relief or as a runner for supplies such as linen, the sitter cannot leave the patient's side for. This is appropriate as there is little need for assistance with activities of daily living. This will allow the sitter to better assist the other patients assigned. Jenny has traction, which require careful maneuvering of the patient to assist with activities of daily living. With a year of experience on this floor and 3 years total experience, this aide should be familiar with traction. Cheryl has new onset confusion, which may require more frequent rounding to ensure safety. The mixture of seriously ill and relatively stable will allow the aide to assist the nurse and provide care to all patients. Charlie has only been out of orientation for 3 weeks with only 6 months total of job experience. A cooperative, alert, and oriented patient requiring a safety sitter due to suicide precautions is appropriate for this aid. The nurse should take note to ensure Charlie knows the specifics of the suicide precautions, like what the patient can and cannot do or have, as well as what Charlie should be on alert for and when to contact the nurse. Delegation is an integral part of keeping the unit flowing smoothly. To that aspect, nursing assistants will be delegated the following tasks: routine vital signs, activities of daily living as needed, intake and output, feed, bathe, and dress patients as needed, serve meals, make beds, and keep rooms clean, answer call bells for help, and observe changes in patients' condition or behavior. These tasks are ones nursing assistants are certified to handle and ensure the nurse is able to perform more intricate patient care tasks. Orders. Let's discuss orders nurse by nurse, the order in which each nurse will take care of their patients and complete orders. Starting with me, the charge. First, medicate Jethro with 2 milligrams of morphine and 1 milligram of Ativan. Then perform inline suctioning 15 minutes after medication administration. After that, I will assess Gertrude, ensure her safety. Get an order for a PRN antiemetic from the provider. Once Gertrude is safe, I will reassess Jethro, determine decrease in anxiety, pain, and increase in oxygenation after suctioning. Then check in with the staff. Schedule a one-on-one time with each staff member at specific intervals to determine patient status, updates, and ensure delegated tasks have been completed. During this time, me, as the charge, should determine if any of the nurses need assistance with their patients, as everyone on this unit is crashing. Completing orders in this order will provide the best patient care while maintaining safety. For example, pre-medicating Jethro with pain medication and anti-anxiety prior to suctioning allows him to be better able to tolerate the procedure, which in turn will result in a decrease in pain, anxiety, and ensure better oxygenation with a decrease in his work of breathing. Every nurse will reassess, medicate as needed, and ensure the safety of their patients throughout the shift. This can be accomplished through the use of hourly rounding to ensure the patient needs are met with proactive and purposeful steps. Pat, the new graduate RN, will first perform a neurological assessment on Cheryl and contact the provider for an IV antihypertensive. Ensure Charlie, the new nursing assistant, is aware of suicide sitter requirements. Specify to Charlie what needs to be reported to the nurse, when to call for assistance, and reinforce safety precautions, such as only plastic utensils, and the room is to remain free of anything that Jason can use to harm himself. Assess Jason for safety. Administer an IV antihypertensive to Cheryl. Recheck vital signs 30 minutes after medication to ensure lowering of blood pressure. If not corrected with medication, speak with the provider about another line of medication. Reassess, medicate, and ensure safety as needed throughout the patient safety throughout the shift. This is part of the nurse's daily routine plan of care for patients. Again, an excellent utilization of hourly rounding is to anticipate the patient needs. Logan, the experienced LPN, Jamie will place the chest tube collection chamber upright, determine where the leak in the system is. If the leak is within the tubing, reconnect it. Then refill the water chamber and patient condition should improve. If the chest tube has become dislodged, place the Vaseline gauze over the opening, place the tube with sterile water, and call the provider immediately to place a new chest tube. Increase oxygen to maintain oxygen saturation 91 to 93% on a non-rebreather masks. Non-rebreather masks can go up to 15 liters per minute. At 4 liters per minute, this is a gross underutilization of oxygen and the patient is desaturating. Ensure the patient's vital signs begin to normalize. Then check a fingerstick blood sugar on Cara, enforce limitations and safety precautions. Reassess Jamie's vital signs. The oxygen should be improving, heart rate and respiratory rate decreasing, heart rhythm returning to normal. At this time, determine if an PRN anti-anxiety or pain medication needs to be given depending on patient presentation. Recheck the fingerstick blood sugar on Cara every 2 hours as ordered. If 3 consecutive fingerstick blood sugars are less than 150, discontinue the drip and evaluate for discharge. Make provider aware of updates. Reassess, medicate, and ensure safety as needed for patient safety throughout shift. Alex, the experienced RN, will first administer 2 liters O2 via nasal cannula to Amelia. Saturation should increase above 93%. If not, increase the oxygen to no more than 4 liters per minute via nasal cannula. Patient presentation should improve, decrease in cyanosis, but patient will remain pale due to GI bleed and need for blood transfusion. Assess Amelia's lung sounds. The chest x-ray has been ordered to rule out pneumonia. Assessing the lung sounds to determine if abnormal lung sounds are the reason for the desaturation. Determine if the chest x-ray could be performed at bedside to decrease the need to move the patient. Call the provider for immediate orders for Amelia, an antipyretic for fever, normal saline bolus to improve blood pressure and decrease heart rate. While awaiting orders, place ice packs on the back of the patient's neck, under the arms, and at the femoral artery to decrease the temperature. Blood transfusion will begin when patient's temperature is under control. To ensure the temperature is related to infection is not a mistake for a blood transfusion reaction. Call the provider about Jenny. Cool blue toes on the affected leg are indicative that the extremity is not receiving blood flow. Administer a PRN antihypertensive and pain medication to Jenny. Assess traction. If traction is not in place, provider will have to place a nurse to maintain. If the traction is in place, ensure the weight is not on the floor and the limb is aligned. Reassess Amelia's vital signs. Pre-medicate and begin blood transfusion for Amelia, provided the temperature is decreased. If no decrease in the temperature, provider will need to be called for further orders. The nurse will stay with the patient for the first 15 minutes of the blood transfusion. Provide wound care for Amelia. Wound care may be delayed until the blood is infusing, as this is not a priority nursing action, but the order must be completed before the end of the shift. As always, reassess, medicate, and ensure safety as needed for patient safety throughout the shift. Time management. As a nurse, time management is an essential skill that requires practice to learn how to juggle the many duties involved in nursing. Some tips from an article in Forbes magazine can help enhance the care you give throughout your shift. Set a time limit for each task. This is utilized in nursing by adhering to hourly rounding. Knowing you'll be back in an hour for each patient allows them to know what they will need in that time. An example of this is, I will be back in 1 hour to recheck your blood sugar. What can I bring you then? Use a to-do list. Taking 20 minutes at the start of the shift to organize the tasks I have to do throughout the shift allows me to manage time, prioritize, and determine where the majority of my time will be spent. This also allows me to see which tasks can be delegated to others and which tasks I might need help with. Be present. Remain focused on what you need to do. Leave your baggage at the door. If you have to have your phone on due to family obligations, make sure your family knows to only call if there's an emergency. Constantly stopping to chat can be detrimental to your patients and places a higher workload on your coworkers. Cluster care. If you know you're going into a room to reassess the patient, bring that patient's medications, offer to take that patient to the restroom, tidy the room to prevent clutter that can lead to a fall. These little things will prevent you from spending 20 minutes going back and forth to the same patient's room, one task at a time. Communicate. Communicate with your charge nurse. In this scenario, the charge nurse assigned herself to relatively stable patients to ensure that she was free to assist the other nurses on the unit with their critically ill patients. In this scenario, the charge also scheduled time with each nurse to get updates, assess how the nurse was handling the assignment, if any help was needed, and determine that every task had been completed. Delegation helps with time management. No one nurse can carry the world on her shoulders. Occasionally, you must rely on the nurse standing next to you for a helping hand and be ready to offer that helping hand when the tables are turned. Utilizing time management recommendations will offer enhanced care, a smoother shift, and allow you to maintain professionalism without the feel of drowning under the overwhelming needs of the patients on the shift are managed.